Thank you for joining today's call with Governor Andrew Cuomo, Governor Phil Murphy, and Governor Ned Lamont. I will now turn it over to Governor Cuomo.
Thank you all very much for joining us, and thank you for joining us on short notice. It's my true pleasure to be with my colleagues, Governor Phil Murphy of New Jersey and Governor Ned Lamont of Connecticut. We work very well together. We've had a lot of good outings together. I brought Governor Lamont up to Lake Ontario. We went fishing. He promised that he was going to return the favor. I've heard nothing from Governor Lamont since then. With Governor Murphy, I'll give you an idea. You know, the striped bass are starting to come up. They're going to pass New Jersey first. So if you have an inkling, you have a ready, willing, and able fishing partner.
Note to file.
Okay. But I tell you the truth, I've been in this position a number of years, and I'm really blessed to have Governor Lamont and Governor Murphy as my colleagues. There is no doubt, especially today with what's going on, that when states can work together well, it makes all the difference in the world. With this coronavirus, I think it's fair to say that we need the federal government to do a better job than they have been doing. And this is my opinion. The federal government has to step up. They have been behind from day one on this crisis. We knew this was happening in China back in November, that we are surprised in March and still scrambling to get testing in place and getting a healthcare system in place. It's inexcusable. And states, frankly, don't have the capacity or the power to make up for the federal government. So we're doing the best we can, but we really need the federal government to do what it's supposed to be doing. There are two areas that I think the federal government should be most helpful on: closings to reduce density. You watch the national news today, and it's a hodgepodge of different actions by different states and different cities all across the country, different places taking different actions. And secondly, in hospital capacity, where we're going to have a real problem is when these cases hit their apex and descend on the healthcare system, and we will not have enough hospital beds, period. I sent the president a letter saying we need the Army Corps of Engineers to come in here now to start building temporary healthcare capacity. In the meantime, we do what we can as states on density reduction policies and coming up with the same rules for closings is imperative. In New York State, my state, like Governor Murphy's state, Governor Lamont's state, I'm in charge of my state, so I make sure all the rules are the same in my state. New York City can't do anything different than Nassau County or Suffolk County or Westchester County, because if that happens, people just will shop among the different locales. You close a bar in Nassau, but you leave it open in New York City. All you're doing is having people drive from Nassau County to New York City, which is the last thing we want to do. It's also true among states. If I take certain actions or Governor Lamont takes certain actions, we're all in the same area. Any one of our residents can get in a car and just drive to the neighboring state to do whatever they want to do. So we have agreed to a common set of rules that will pertain in all of our states. So don't even think about going to a neighboring state because there's going to be a different set of conditions. I believe that we are the only region in the country that has done this, and I applaud Governor Murphy and Governor Lamont for that. As I said before, I think the federal government should have set up a uniform set of rules, but absent that, having regional coordination at a minimum is imperative, and that's what we're doing today. We all agree that there will be no crowd gatherings of over 50 people. So if you can't do a party in New York City, you can't do a party in New Jersey, you can't do a party in Connecticut over 50. The casinos, which we all have, will close at 8 p.m. tonight. Gyms will close at 8 p.m. tonight. Movie theaters will close at 8 p.m. tonight. And bars and restaurants will close at 8 p.m. tonight, and they'll only offer takeout services. I want to thank, again, my colleagues for their cooperation and their foresight. It's not easy to get states on the same page. It sort of runs against the normal jurisdictional orientation. But Governor Lamont and Governor Murphy realized that this is not the normal times. And in extraordinary times, extraordinary leaders step up to the plate, and Governor Lamont and Governor Murphy are extraordinary leaders, in my opinion. And I'm blessed to have them as my colleagues and my friends. And with that, I'll turn it over to Governor Murphy.
Governor Cuomo, Phil Murphy here. Thank you so much for your comments, and would say the same thing right back to you. I would echo many of the things you said, including I don't know there's any three governors in the country right now who are harmonizing and coordinating as much as the three of us are. And I think that's a good thing, and hopefully can set an example. In fact, I've had a good back and forth exchanges with our good friend and colleague Tom Wolf in Pennsylvania to New Jersey's west, and I'd hope that we could mimic a similar harmony there. I've said several times over the past number of days in our state, and I know this goes for all three of our states, we're going to get through this. We're going to get through this as one family, in our case, one Jersey family. But we will get through it, assuming we all do our part. And it's undeniable that we have many good friends and neighbors, in our case, in both New York and Connecticut, beginning with the two of you guys. We are all in this together. And folks know this, but let's remind everybody that the work against this coronavirus isn't just up to some of us. It's got to be up to all of us. And that, by the way, includes the members of the media who are on this call, who have been working nonstop to keep people informed with facts. And I know my fellow governors join me in thanking them for their diligence. Later today, we're going to go into a lot more detail on the Jersey agenda. Again, a lot of this harmonized with New York and Connecticut. And again, I want to thank Governors Cuomo and Lamont. In specific to us, I'll be announcing our plans for closing our schools and institutions of higher education. That's a big step, but it's just part of a broader effort to encourage the so-called social distancing and get residents to stay home and play their role in slowing the spread of illness, the so-called flattening of that curve. And in addition, again, Governor Cuomo alluded to a lot of this, and a lot of this is in harmony across our three states. All non-essential and non-emergency travel in Jersey is strongly discouraged, beginning tonight at 8 p.m. until 5 a.m. each day. This will remain in effect for the foreseeable future. We want everybody to be home, not out. Businesses which play a direct role in our response efforts are necessary for the public's welfare, and you all can figure out who they are: supermarkets, grocery stores, pharmacies, medical offices, gas stations, etc., among a very limited list. They'll be able to be staying open until after 8 p.m. After 8 p.m., all non-essential businesses must close. And then during the daytime hours, as Governor Cuomo alluded to, businesses may remain open if they limit their occupancy to no more than 50 persons and adhere to social distancing guidelines. All bars and restaurants, again, across our states are closed for eat-in services effective 8 p.m. tonight. After 8 p.m., these establishments may open for takeout and delivery orders only, again, until further notice. All movie theaters, gyms, casinos, and racetracks, again, as Governor Cuomo has already alluded to, will also close. I'll give more details on the Jersey specifics later on this afternoon. Online gaming, by the way, will continue. As Governor Cuomo also said, all public events of 50 or more persons are canceled effective 8 p.m. tonight. And we can't say this enough, that everyone needs to stay in and be safe. And just because you don't feel sick, and this is a particular shout out to our young people, it doesn't mean you aren't carrying the virus. The last thing anyone should be thinking about is going out and potentially spreading the disease. As I mentioned, we've got a lot of specific steps to New Jersey that I'll be speaking to the media in a few hours, and after I get my full overnight briefing from our health commissioner and our public safety team. Again, you're known by the company you keep. I couldn't be in better company than with Governor Andrew Cuomo and Governor Ned Lamont. I thank them for their partnership, their own leadership in their own states, and again, their cooperation on getting through this emergency. And again, if we all do our part, each and every one of us, we will get through this and we'll get stronger. We'll have the strongest region in the country, if not the world. With that, we'd love to turn things over to Connecticut Governor and our friend Ned Lamont.
Hey, Phil, Andrew, thank you. And as you say, Phil, we are in this together. And we are in it together not as towns and cities and states, but now increasingly as a region. And that's what Governor Cuomo emphasized so much. We were out there fishing in Lake Ontario, 7 or 8 months ago. We talked about just about everything. But COVID-19 was not on the horizon at that point. And this is changing so fast. We've got to work together on a coordinated basis to make sure this is how we go. I got to say, we had New Rochelle and Westchester, and a lot of the infection start there came right through Fairfield County. That is a region, and this is a virus that knows no borders, and that's what we're trying to do. Is probably the first region in the state to work together on such a coordinated basis, as Governor Cuomo said. I'm looking around the rest of the states and the rest of the countries in terms of what we can learn, and I've seen, if you look overseas, you look at Singapore and Hong Kong and Asia, where they really had strong, forceful social distancing measures, and how they were able to flatten that curve and save hundreds of thousands of lives. And we also look at Italy and France, where as a freer society, perhaps they were not able to be quite as forceful. And I think you see what's going on there in the epidemic, and as Governor Cuomo said, overwhelming the hospital situation. So this is why we've got to work together on a united basis to send the message and give people that sense of urgency that we're doing what we can. I mean, I noticed the pictures of Disney World yesterday, packed until they closed it last night. Many of our bars and even restaurants were busy, and that's why just this past weekend, and that's why we're stepping forward in a very clear and demonstrative way to say we're going to work on this together on a unified and regional basis. And as Phil said, and if you have any options at all, stay home. If you're over 60, 70, stay home. If your grandchild wants to visit you, stay home and say you're going to learn to FaceTime, because these are the folks who are by far the most vulnerable. I've got to say, in terms of our restaurants, we're thinking long and hard in terms of takeout and way that we can support them. We have a lot of people who are now buying gift certificates. They're not going to go to the restaurant this week or next month, but we're doing everything we can to make sure they can keep going. As we close down the last of our schools by the end of today, we're thinking long and hard about folks with free and reduced lunches. And we're keeping those cafeterias open and making sure that we have pickup service there so people don't have to go without their meals. We're working very hard in terms of daycare, prioritizing our public health workers and those that have to be at work, public safety as well, and making sure that those folks know that their kids are taken care of so that they can take care of us. Something I'd like to work on with Phil and Andrew, we're working with our online scholastic folks, and we're going to have a free service available to all those kids who are home from school so that we can at least maintain some semblance of education and also give them added reasons why they ought to be not on the streets but at home. And I just can't not repeat what both Phil and Andrew said. We've got to work through this together. The feds have been asleep at the switch. They've been slow off the draw. We're the ones trying to figure out how to add capacity for our hospitals. We're the ones trying to make sure we have necessary ventilators and masks. And if we do this on a regional basis, we're going to get through it. I found one story sort of hopeful that was when Apple closed down all their stores in China some months ago. and we said, what the heck's going on? And just recently, they've closed down all their stores in the United States. But you maybe noticed in China, they started opening their stores just last week, as things maybe have the chance to slowly get back to normal as you're cautious about it. And we're going to get through this if we work together. But we cannot take our eye off the ball. And I think getting together with my fellow governors is the right way to proceed. Back to you, Andrew.
Thank you. Thank you, Governor. And as usual, well said. And I think your point is profound. You look at the history, the faster and better societies closed down, the sooner they reopened. So that's a word to the wise. Just a point of clarification, when we say these facilities close down at 8 p.m. tonight, they will then remain closed until further notice. And the Governor Phil Murphy, Governor Lamont, and myself will be talking about the opening date to see if we can also coordinate the opening date. Operator, if you can open the question line.
At this time,
the reporter to identify themselves and direct the question to whomever they want to direct it to.
At this time, if you would like to ask a question, please press star 1 on your telephone keypad. Again, that's star 1 to ask a question. We'll pause for just a moment to compile the Q&A roster.
We agreed that Governor Lamont would take all the tough questions. Didn't we agree with that, Phil?
100%.
Hey, Andrew, on a tough question, what are we going to do about our tribal casinos?
Well, as far as the law allows, we're looking at that legally also. I don't know that there's a public health law that could affect the tribal casino. We don't think so, but we're looking at it. If I come up with anything, I'll let you know.
We're being forceful that they should follow the public health lead of all the other public institutions here, but we should do something together on that.
Yeah, my pleasure.
And your first question comes from the line of Zach Fink with New York One.
Governors, good morning. Governor Cuomo, I wanted to ask regarding your call for the Army Corps of Engineers to come in and maybe retrofit certain buildings in order to make them kind of makeshift hospitals. Is it possible, assuming you don't get that federal assistance, that the State University Construction Fund and or the Dormitory Authority could contract out and do that work relatively quickly themselves? I know the SUNY dorms, for example, should have some space.
Well, the best way to do this is the Army Corps of Engineers. I was in the federal government. I worked with them. This is what they do, Zach. They come in, they build airports, they build bridges, they have the personnel, the equipment, and they do it very well. They also have the medical equipment, because remember, they also set up hospitals. For a state to do it, we don't have an existing workforce. We could contract out. We could expedite the contracting. First, it's very expensive, and then you're still going to have the question of the medical equipment, which, as Governor Lamont referenced, it is very, very hard to get this equipment for a state right now. Everybody wants ventilators. Everybody's looking for oxygen tanks. The federal government has a stockpile of emergency medical equipment. But suffice it to say, if the federal government doesn't step up and doesn't step up quickly, states are going to be forced to do whatever they can do on their own. And New York is going to be doing exactly that. Phil, Ned, do you have anything on that?
No, I think it's a fair place to be. We're looking at a whole series of contingency plans in a very similar light. We've had some constructive conversations with FEMA this morning, though that's likely to be much more in the testing lane. But we'll take all the help we can get. I think our big need out of the federal government alongside testing is the personal protective equipment. That's where we have our biggest deficiency right now. In the medium and long term, we're going to need help getting our economy, as we all three will, back on its feet. Andrew, you said the other day there's no amount of money in any of our states that'll be able to do that on our own. But we've got a big immediate need for personal protective equipment. I think that's where our focus is right now.
we're going to need hospital beds. We know we need hospital beds over the next couple of weeks. We are woefully short as a region, as a country, in terms of being able to take care of folks, especially if this surge comes the way we expect it. Even if we're able to flatten the curve in the most optimistic way, we're badly outgunned on that front. And that's where we do need the feds to help step up. You saw what happened in China and other places where they were able to rebuild new hospitals and add new capacity in very short order. We have some catching up to do there.
Amen.
Your next question comes from the line of Elizabeth Joseph with CNN.
Hi, this is a question for all the governors, actually. Thank you for having us on this call. I want to talk about transportation and communication options between the states and also within your own state. Is there any discussion on either shutting down any of the public transportation in your individual states or lines between each of your states?
Not here. That was Andrew. Not here.
Yeah, I mean, we're looking at capacity on an iterative basis. This is Phil Murphy in Jersey. We're trying to right-size the equipment to the ridership. Huge focus, as I know it is in New York and Connecticut, on hygiene, cleanliness, making sure that all of our equipment is as clean and germ-free as possible. That's been our big focus.
The only other thing I'd add, Elizabeth, is we're working with our internet service providers and telecom, upping the capacity, getting rid of the caps, making it easier for people to learn at home, telecommute from home, and telehealth from home. Doing everything we can to give them incentive to get out of the cars and be able to stay closer to home. And I think it's working. I think you'll find that ridership on our rail is way down.
Yeah, that's a good point. We're doing that in New York also. You want people to stay home, they have to have the capacity to do the telecommuting.
Your next question comes from the line of Brent Johnson with the Star Ledger.
Hi, Governor. Thank you for having us.
Hello, Brent.
So I'm a little confused. So is everything closing at 8 p.m. tonight, or are they going to be allowed to reopen at 5 a.m., or is that just restaurants? So is everything shut down and only some places can reopen at 5?
I'm going to give this a shot, Brett, because you're a Jersey guy, so this is Phil. I'll start, and my colleagues could come in. If you're a bar and you're a restaurant, you're closing tonight at 8 o'clock for eat-in, period, until further notice. Then it'll be only takeout and delivery. Exceptions to the rule will be the things that you would hope that would be exceptions: supermarkets, pharmacies, gas stations, etc. And then separately, at least in Jersey, and I think this is true for all of us, but we are strongly discouraging non-essential travel between 8 p.m. and 5 a.m. on any given day, including beginning tonight.
Yeah, that's true across the board. They close at 8. They don't reopen until further notice for gyms, etc., movie theaters, etc. On the bars and restaurants, which are a little different, they can do the takeout service. I think that's the confusion.
Agreed.
Your next question comes from the line of Michael Gormley with Newsday.
Hello, Governor. Have you tried to reach out to other states, and did they not choose to participate, or is that something you're going to continue, given the concerns you have with the federal response?
Are you asking, are we still reaching out to other states to join the coalition?
Yes, Governor. I'm wondering if you already had tried to reach out to other states for a bigger regional effort, and if you hadn't, if you have, what the response was, and if you have any plans to try to broaden this.
We'll try to broaden it. This is, Connecticut, New Jersey, New York. We are the quote-unquote tri-state area, and we work most closely together. But we've already had conversations about reaching out to Pennsylvania, Rhode Island, Massachusetts, etc.
Yeah, I mentioned in my comments, Michael, that we've had some good discussions with Tom Wolf and his team in Pennsylvania, and I would expect that those conversations will deepen, and I would bet that we will achieve a harmony that looks and feels, without speaking for Governor Wolf, that looks and feels a lot like the one that you're hearing on this call today.
And we have the same type of relationship going chief of staff level with both Rhode Island and Massachusetts.
And remember, Michael, we had this basic approach when we were discussing about the marijuana laws and the effect on marijuana. So I think this is you're going to see more and more of this, I hope.
I was also going to add to that, Andrew, the states for gun safety that we started. We've got 8 or 10 states in a similar mindset on gun safety as well.
As a reminder, to ask a question, please press star 1 on your telephone keypad. Your next question comes from the line of Laura Meckler with Washington Post.
Hi. Thanks for taking my question. My question is about school closures in particular. The CDC guidelines, which came out late last week, suggest that there could be more downsides than upsides to closing schools, that there are a lot of known risks, including the fact that children may be with grandparents who are at particular risk for the disease. Of course, some of the things you've talked about here today about the children of first responders and healthcare workers. And they say that the data, the scientific data, is not there that closing schools prevents the spread of the disease. And I'm wondering if you could talk about how you balance those very real risks against obviously the decisions you've made to close.
Yeah, let me take a shot at that, and I'm sure my colleagues have thoughts. So do it in a way that accentuates the upside and negates the downside. The downside is, A, people lose child care. First responders may not be able to go to work. Essential personnel may not be able to go to work, especially healthcare personnel, right? Because we're all saying the crash is going to be on the healthcare system. So what we said is the schools can close, but they must provide child care for the essential workers, first responders, healthcare workers. Also, the schools can close, but we're not going to stop the food delivery program for the students who need breakfast, lunch, etc. And third, we understand that there are educational opportunities that are being lost, and we're planning to do that either through telecommuting, electronic communication, or possibly summer school if this has abated to that point by the summertime.
Hey, Laura, I would just add, kids, while they are incredibly infectious, I think you remember that you had kids at school, and while they may not be at the same risk as older folks, in terms of a passing infection, they're just as infectious. So if you look at what's going on around the world in those places where we're able to socially isolate, I know how tough this is on families. That's why telecommuting is so important, because it allows a parent more likely to be at home to take care. That's why we're trying to come up with alternatives so the kids can stay active at home and not out on the streets.
Yeah, I'd have, from New Jersey's perspective, very similar answers. There are very few easy calls on this one. A lot of the calls come with, for instance, enormous pressure on the economy, small businesses in particular going forward. In the school case, the 3 variables, and I think Governor Cuomo and Lamont hit this, number one, food security. We have a lot of, we probably have a couple 100,000 kids in our school system where their only hot, reliable meal in the day is through the schools. You've got the daycare issues that you've raised in your question, which are a good one and was addressed. And you've also got the remote learning question. We have, again, 250,000 kids who don't have access to a device in New Jersey. So what's that mean? That means pre-printing monthly syllabi, et cetera. So none of these decisions are easy. None of them come without offsets. But I think we believe strongly that this is the right path to pursue.
Look, we closed nursing homes to visitors. 9-year-old Johnny normally wants to see his grandmother or give her a kiss, so she knows that he loves her. In this case, not seeing Grandma and giving her a kiss is a way of telling her you love her. Let's take one more question.
Your next question comes from the line of Matt Karen with Fox 61 News.
Hello to all you governors. Thank you for taking my question. I just wanted to once again go back to the issue of tribal casinos. I know we have several of them here in Connecticut. What, if any, power do the states have to shut them down since they are considered sovereign nations?
Well, Governor Cuomo and I are talking about this since we both have tribal casinos in our state, and we are urging the tribes in the strongest possible way. They ought to be closing down those casinos. They've been good legal partners for us for quite some time, but there are legal and jurisdictional issues there. I hope and think they'll be doing the right thing, and we're going to talk with a unified voice.
Yeah, amen. This is a do the right thing situation. You know, government isn't always about laws and legal ability and litigation. Everyone is in the same situation here, everyone. And I think the tribal casinos will understand that also. With that, gentlemen, I can't thank you enough for your friendship and for your skill and your expertise and your leadership. And we've made our states safer for all of our citizens working together. And I can't thank you enough.
Amen to that, Governor, and to Governor Lamont, same. And my guess is this won't be the last time we'll be on in calls like this.
We do this on a regular basis. Thank you, guys.
Amen.
Yes,
Take care, everybody.
Thanks, guys. Thanks. Bye.
Thank you for your participation. You may now disconnect.